A 60-year-old male with diabetes goes to the ER with new onset word-finding difficulty. He previously felt well only a few days ago, but noticed trouble with speaking alongside sudden fever and difficulty breathing. He also felt disoriented and confused with new memory loss. In the emergency room, doctors checked basic blood labs and performed a CT scan of his head, all of which were normal except for signs of increased inflammation seen in the blood. Due to concern for a brain infection, they took a sample of the patient's spinal fluid from his back and found that it was cloudy, thick, and very abnormal. The doctor started several medications in hopes of treating the patient for an infection, but despite their best efforts, the patient became comatose only 2 days after presentation. After 3 weeks of hospitalization, the patient was sent to rehab, but after 10 months of rehabilitation, he was still unable to speak or use his arms or legs. What was the final diagnosis? Herpes simplex encephalitis, a severe viral infection of the brain with a mortality rate of 70% that leaves 97% of surviving patients with abnormal neurologic function. Herpes simplex encephalitis is caused by the herpes simplex virus, the same virus which causes the common cold sore. So why do some people get a severe debilitating brain infection while others only have a mild cold sore? Let's talk about it in this video. Modern germ theory has been around since the late 19th century and was originally proposed by Robert Koch, who discovered that small little organisms could cause disease. Koch was a German physician who spent much of his career experimenting with anthrax. Yes, that anthrax. He noticed small rod-shaped bugs in the blood of cows who had died of anthrax, and when he gave some of that blood to mice, the mice also developed anthrax. This discovery would go on to inform our current understanding of infectious disease, that most infections are caused by small pathogens, usually bacteria or viruses or fungi. These little creatures can't be seen, but are literally everywhere in the world. There's a common myth that our bodies are more bacteria than our own cells. As it turns out, that's not exactly true, with the real ratio of body cell to bacteria closer to 1:1. Even so, with 30 trillion human cells, that means we have close to 30 trillion bacteria just living in our own body. That's a freak ton of bacteria. When we think about getting an infection like a UTI or sinus infection or skin infection, we imagine that a bad bacteria has gotten a foothold in our body, multiplying and creating more bad bacteria, which leads to disease. Ironically, before infectious diseases were thought to be infectious, an opposing theory was that these diseases resulted in a specific weakness of families or populations. In other words, people got sick from infections because of something they inherited. As it turns out, this may be more true than we previously realized. As we learn more about the interplay between germs and the human body, it's becoming more and more clear that our own body's response to germs plays a significant role in our disease. Take, for example, the disease of sepsis. Sepsis is a life-threatening complication of severe infection. The body attempts to fight off the foreign bug with its own immune system, and as a result, it triggers widespread inflammation, which can result in multi-organ failure and even death. What is not often obvious about sepsis is that it's incredibly hereditary. If you have a biologic parent who dies of infection, your own risk of mortality from infection is increased 5-fold. This is stronger heritability than both cardiovascular disease and cancer. We often talk about family history for heart disease and cancer, but when was the last time you heard about family history for infections? As an example, it was clear early on in the COVID pandemic that some individuals would shrug off COVID like a mild respiratory infection, while others would develop an acute respiratory failure requiring artificial ventilation, leading to multi-organ failure and even death. While some obvious risk factors for severe disease like older age, diabetes, and immunocompromised state were already known, it became obvious that the genetic makeup of an individual also contributed to the susceptibility and response to the infection. So began a massive collaboration called the COVID-19 Host Genetic Initiative, an international partnership between academic universities, private companies, and genome banks to understand the specific genetic factors contributing to COVID-19 infection. I'll link to one of their recent papers below, but it's a huge undertaking and an amazing collaboration between brilliant minds to better understand the complex interplay between COVID and human genetics. The Human Genome Project generated the first sequence of the entire human genome in 2003 and provided fundamental information about the human blueprint. Since then, a new type of research called the Genome-Wide Association Study has allowed scientists and researchers to screen the human genome for associations between millions of genetic variants and a particular disease or trait. These studies have expanded in their reach and scope with the emergence of private U.S. companies like 23andMe and Ancestry DNA. As far as the tragic case of our earlier patient with herpes simplex encephalitis, scientists have already discovered at least one mutation which impairs our own body's immune response against this virus. Be assured, though, that while over half the U.S. population has the herpes simplex virus, only a very small number will ever get this infection in the brain, amounting to only about 1,000 to 2,000 cases every year. So why do some people get this severe manifestation of the virus while others only get a minor cold sore? Well, we still don't know the full answer to this question, but I suspect that answer is, at least in part, in our genes. For those who are interested in learning more about the genetic theory of infectious disease, I'm attaching a fantastic summary in the description box below. Thanks for watching.